colleagues are unwell at home, wishing them all the best. It's going around, so I hear. Now, I'm joined here today by Dr. Samantha Merton, who's the chair, the president of the College of the Royal New Zealand College of General Practitioners. She's going to tag team with me and give a bit of an update on what she and her colleagues are seeing in general practice primary care at the moment, and we'll both be available to answer questions. So welcome, Sam. Thanks for making yourself available. So first, just an update on the latest situation. Today, we're reporting 21,015 new community cases of COVID-19. Of those, 845, not of those, but at the moment we have 845 people in hospital, and of those, 16 are in intensive care or high dependency units. And our total number of active cases is 208,625 across the motu. So, since the 23rd of February, so roughly the last couple of weeks, about 87% of our reported cases have been diagnosed through use of rapid antigen tests. 4% are rapid antigen tests with a confirmatory PCR test, and the remaining 9% have been diagnosed with PCR tests. The vast majority of results in recent days are rapid antigen tests, and so of today's cases, 97% have been diagnosed with a rapid antigen test. Today in the northern region, we're seeing a similar number of hospitalisations as we've seen in the last couple of days, at 587, suggesting perhaps the numbers are levelling off there, but my colleague Dr. nzherald, who's the Chief Clinical Officer for the Northern Region Health Coordination Centre, will provide an update in Auckland tomorrow, and we'll be able to go into that in more detail. An update on our whole genome sequencing. Nationally, our data since the beginning of the year, 1st of January, shows that 21% of people hospitalised who had their genome sequenced had the Delta variant, and 79% were Omicron variant, reflecting the fact that most of our cases in hospital through January were Delta. By comparison, of hospitalised patients who had samples received at ESR and whole genome sequencing in the last 4 weeks, none had the Delta variant. The Delta variant, in fact, was last detected in any community sample that was sequenced in mid-February. That was the 15th of February. And ESR's latest report from this morning shows that of the most recent 47 hospitalised cases where there was sequencing done, they were all Omicron, and of those, 25 were the BA1 subvariant and 22 the BA2 subvariant. And if you look at the pattern of all sequencing of all cases in the community, we've seen a growth in the proportion that are that BA2 variant. It's now about 2/3 of the cases that have been sequenced in the last week or so. So saying, although we haven't got any of our recent hospital admissions with the Delta variant, we do know Delta is still out there in the community. And for example, at least 38 cases in the week ending 5th of March were epidemiologically linked to the Delta outbreak, just that none of those were sequenced. One of the challenges I know parents have been having is reporting rapid antigen test results for their children or for other dependents online. So I want to acknowledge those who have been trying hard, perhaps ringing the 0800 number and experiencing delays. We are aware there was a temporary issue on Tuesday this week where some callers felt that had a problem with registering their cell phones for callbacks and weren't receiving that callback. We've increased capacity in the 0800 system, so that phone number now has increased capacity. That's 0800 222 478. But what I can say is also from tomorrow, parents and caregivers will be able to report test results for children 12 and under and other family members through My COVID Record as well. So we've increased capacity on the phone line and they will be able to do it online from tomorrow. Once again, and reflecting back on the fact that 97% of our cases today are from people having logged their positive rapid antigen test, I want to thank everyone who is doing so, and it really does help us understand the extent of the outbreak and the pattern across the country. But at this point I want to hand over to Dr. Merton to give us an update from primary care. Kia ora.
Kia ora. Thank you, Ashley. So, in general practice and across anything in primary care, you can imagine that there's been a massive change in the volume of work, and it's been quite substantial. The college put out a survey to all its practices, and we had 478 responses of the 1,000 practices that are across the country, and 30% of them were looking after more than 20 patients a week ago, and 80% of them are looking after more than 20 patients now. So in my practice, in the last 2 weeks, I've gone from 1 patient to 57 patients the following week to 127 the week following that. So it has put a huge amount of work on general practice. I think when you think about the fact that there are 20,000 people who have got COVID every day, and across the country 50,000 consultations normally happen every day, that's a 50% increase in workload if we had to deal with every one of those 20,000 that came through. So we recognise that the people who are physically generally well, have been fully vaccinated and boosted, will have a very mild illness, will be able to manage it at home, and it will be like the normal flu. And if you need to be in touch with your general practice, usually it will be if other things are going on for you, or you do need some care. So just make sure that you've got what you need at home. If there's 208,625 in the country, in the community, then that means there's a lot of work for us if everyone was calling general practice. So Healthline's are also available. My colleagues want me to remind everyone that we are working really hard, doing our best for our patients. And although we are prepared and have done the best that we could do for when the outbreak occurred, it's still going to be a little bit messy for the next couple of weeks. And that's just because people will want care, but there are other people who really need care and are quite vulnerable. So GPs across the motor will be concentrating on those people who are vulnerable and need the most care, and will be contacting them if they need to. There's also issues around isolation and needing manaaki support, and so sometimes people will seek that out through their general practice, and that's okay, but it's still another bit of the work that we end up doing. The other thing that we've found is that across the country people are stressed. People are stressed about having COVID, about being isolated, about not being able to go out, about having family members who might be sick, and the practices are also under pressure to deliver as much care as they can, and so that stress can often end up with a lot of anxiety, and therefore people's emotions might flare, to put it politely. So my colleagues have suggested that people be kind to their practices, especially the administration and reception staff who bear the brunt of the calls that come through, and maybe saying your doctor will ring you back in a few hours, or having to delay the care that you might expect. So please just have a bit of patience as patients, and be kind to the staff. The other thing that we want to remind everyone is being boosted, having fully vaccinated and boosted, is the best thing that you can do. And also that as general practice, we are as open as we can be for providing service, and don't delay or defer your care, because we have found previously when there was a lockdown 2 years ago that after a couple of weeks we'd start to see people coming back in who had let things ride for a while. And please don't let things ride. Please be in touch with your general practice if you need to, because that's what we're there for, even though we might be a little bit under pressure. Thanks very much, Ashley.
Thanks, Sam. Just a couple more things I'd like to cover first, and bear with me on this. I'd like to explain some changes to our reporting of COVID-related deaths. So from today, we will be moving to a new reporting approach, and a sort of dual reporting approach. So first, we will automatically report all deaths of people who die within 28 days of testing positive for COVID-19. This is the approach that's used by the UK and many other countries, and is the one that we will use for our official reporting, and have used for our official reporting to the World Health Organization. Within that total number of deaths, we'll also move to report those deaths within 3 categories. First of all, people for whom it is clear that COVID-19 is the cause of their death. And as of today, that number is 34. The second group is people who had or were subsequently found to have COVID-19 when they died, but their cause of death was clearly not COVID-19, so they died of another cause. And as of today, the confirmed number in that group is 2. Then there's another group, which is the largest, which is those whose cause of death is still under investigation. And many of those will be with the coroner to determine the cause of death. But we know for sure they had COVID-19 when they died. It's just not clear whether that was the cause of their death or they happened to have COVID-19. And as of today, that number is 48. Now, if you are quick with maths, you will have noted that total is 83, which is larger than the total 81 that is the number of all people who have died within the last 28 days of having had a COVID diagnosis. So, over the course of the pandemic to date, we have publicly announced those 83 deaths. In the past, our approach to announcing the deaths has not always matched up with that new definition, which is everyone who has died within 28 days of a COVID diagnosis. But from now, we will be reporting both numbers. We've also done some reconciliation of our numbers, and over the last 2 weeks, there have been an additional 9 deaths that are recorded in our deaths database of people who have died within 28 days of a COVID diagnosis, but those hadn't to date been publicly announced. Now, the main reason for this is these are people who might, for example, have died in an aged residential care facility. A GP might have certified the cause of death, but it wasn't notified necessarily to our public health unit and notified through our old system. So, I want to just confirm that our total number of COVID-related deaths to date, and we'll just recap on this because there are quite a few numbers here, now sits at 91. And this is when we add in these additional deaths that have occurred in the last fortnight, including one just yesterday at North Shore Hospital, that we are capturing from our deaths database. Of course, each one of these deaths represents a person and a whānau community that is grieving, so I want to just acknowledge that and pass on my condolences to those who have lost loved ones, and in particular in this last period of weeks. So, our total deaths announced now that we believe are COVID-related is 91. We will provide an update on that number as there are new deaths recorded on our website. And we will also break that down into those 3 categories: those who we know died with COVID, those who died from another cause but happened to have COVID incidentally, and those whose deaths remain under investigation. I do want to emphasise that New Zealand's total number of deaths remains very low by international comparison and our death rates. And furthermore, and this is important, New Zealand has a very low case fatality rate internationally, which means that people who get COVID here are getting the right care they need and are being well looked after, whether that's care in the community in general practice or through other community providers, or whether they require hospital level care, including intensive care. Finally, I want to finish with an acknowledgement and acknowledge our health workforce across the motu, who are just responding extremely well to this rapid increase in workload that Sam has outlined. I'd particularly like to give a special shout out today to the extra effort that our home carers are putting in for disabled whānau, those who require home and community support services, and for those people who receive those services who often, because at the moment their usual carer might be unwell, they are being cared for by someone different, and just want to thank and acknowledge that. We can all, of course, continue to play our part by doing the basics well: hand hygiene, wearing a mask to protect yourself and others, physically distance, and please, if you are unwell or if you're meant to be isolating as a contact of a case, do stay at home. Thanks very much again, and we're now open to questions.
Dr. Bloomfield, how many of those hospitalisations today are actually there because of COVID rather than other illnesses?
The vast majority. And